this video today is going to be about filler and specifically about the fear that a lot of people have now that filler can make you look very unnatural, or that it's bad for your body, or that it migrates and ends up all down in the lower face. The first thing I want to explain is what filler exactly is. If we're talking about HA fillers, which stands for hyaluronic acid, it's a sugar molecule that your body naturally produces and it hydrates the skin. They're meant to be placed inside fat. And if you place filler inside fat, you'll get a natural result. And you have deep fat pads and superficial fat pads. They're all over the face, including in the lips. If you try to place filler outside those fat pads, like for example in muscle, that's when you can start having migration, because the muscle constantly moves and it squeezes the filler out. You see that a lot in the lips, in the under eye area a lot. You can see that along the jawline if you put filler in the gonial angle. Another reason why people can look unnatural with filler is when you try to do too much. If you overfill people, they look artificial. Filler is really meant to restore volume that you've lost, or to place volume in an area where you have not enough, like for example in the chin. If you have people who have genetically a recessed chin, putting some filler there to bring it out is a good idea, but you don't want to just keep on going and going. At some point, you have to say no. When you see a patient that comes to you and says, I want filler on my cheeks, and they already have enough volume there, I tell them, no, that's not an area where you need filler. It's not going to look good. It's not going to do what you think it will do. Let's take a look and see where are the areas where you are lacking volume, and that's where you should place filler. I think that is actually one of the things that doesn't happen enough in our industry. Doctors are afraid to tell patients no, because they're afraid that the patient will leave and go somewhere else. And that does happen. As a doctor, my first responsibility is to do what's best for the patient, not what's best for my wallet or for our practice. My philosophy has always been look natural. I don't want it to be obvious that people have had filler. And I'm very happy that that's now starting to become a trend. I still love filler. I think it is great to use in areas where people are volume depleted. And I have plenty of patients who I like to encourage to do filler, but I also have people that I say, I'm sorry, that's just not a good idea.